Good afternoon, and thank you for joining us today as I update you on the COVID-19 pandemic here in Erie County. Today, we have 3 additional confirmed positive cases that have been reported in Erie County, taking our total number of cases to 8. 2 of the new cases are in their 60s, and 1 of those individuals is in their 40s. 2 of the new cases have traveled outside of Erie County, and 1 case came in late last night, and so the investigation is pending as to potential exposure. Contact tracing by the Erie County Department of Health continues on all 3 of these new cases. I want to share that this is the last time that we will bring the specifics about each case, because we believe it's going to become too difficult to keep those numbers straight. But we will continue to report the numbers. So you can assume that any cases we bring in front of you will either be travel or direct contact, and that is associated with each case unless I inform you otherwise. Next, we are aware of a COVID-19 patient who has been transported to St. Vincent Hospital earlier today. This individual was traveling through our county. This is not an Erie County resident and not within the numbers that I gave you earlier. This individual did the right thing. First of all, feeling sick during their travels, they stopped, got a doctor's order, and got tested. The individual's employer then informed this person to isolate themselves in a local hotel. We were not aware that this individual remained in Erie County until yesterday. At that point, we began providing the individual support, since this individual does not have any friends, family, or work associates here. But this is a perfect example of an individual and a business doing the right thing to protect themselves, to protect Erie County community, and anyone else that this person would have come in contact with had they continued on with their travels. It's important to note that this individual, again, is not an Erie County case because her address is in a different state. So the case is not listed on the Pennsylvania Department of Health's database. I want to go back to a question I was asked about yesterday regarding the I-90 rest stops. I did reach out to the state, to my PennDOT contact, who have been constantly updating their options and their responses. Since they initially closed the rest areas, they have reviewed options to open them to provide service access for freight companies moving product, as well as to public customers. And today they are reopening the eastbound Welcome Center location on the west side of the county along I-90. And this included, they cleaned it, they disinfected, and used the proper procedures, and those have been completed, I believe, and that stop is open. And they hope to safely open the Welcome Center on the west side of the county, on the west traffic. It will be on the east side of the county soon. Now to some of the state numbers. We are at a total of 2,219 cases in Pennsylvania, which I said includes those 8 in Erie County. We now have a statewide total of 22 deaths. We also know that we have deaths close to us, with 2 in Allegheny County and 1 in Butler County, both just down I-79 to the south of us. I want to thank everyone who is doing their part to help us stay ahead of community spread in Erie County. As I announced yesterday, we have launched a COVID-19 rumor hotline for Erie County. It is 451-6986. That's 451-6986. And this is for residents to call with any concerns regarding rumors or gossip, things that they need to have clarified. This number is only to report rumors. I'm still hearing reports of young people, particularly, still throwing parties, people hanging out in large numbers at the beach to play volleyball, golf courses, other public places. And if you see these type of things happening in Erie County, you can contact ecdhinfo@eriecountypa.gov or 451-6700. That's 814-451-6700, so that someone can go out and address these issues and explain to people the dangers of their gathering in this way. We've announced several resources in the past week, so we've created a resource for you that explains what contact information should be used for what situation. And this resource page is available at eriecountypa.gov under the resources page on the COVID-19 page. Life-sustaining local businesses continue to do their part, and enforcement inspectors continue to make their rounds when we have questions about a business's practice or whether a business should be open or not. Today, we had 10 more field inspections thus far that were completed by our environmental task force investigators, and I'm really happy to say that all 10 of those businesses were in compliance. Yesterday, we had 18 investigations done, and of those, 16 were compliant yesterday. So thank you to all those businesses that are doing the right thing. Speaking of businesses, the Erie Regional Chamber and Growth Partnership is the lead on economic development across Erie County and is the place for all of our businesses to go for resources in the Northwest region. We know that this COVID-19 pandemic has been a huge struggle for our local businesses. And you can go on the Chamber's website to that resource page and access information regarding local grant programs that are there through both the Erie County Redevelopment Authority, the Erie County Gaming Revenue and partnership with Bridgeway Capital, the Northwest Commission, and so many of our other community partners. And this includes the money that is coming through the Pennsylvania Industrial Development Authority. Many of these are loans, either at no interest or very low interest. We want our businesses to have the resources they need so that they can reopen when we're all back to normal in Erie County. It's also important to remember that the help is available to you, and the Chamber welcomes your calls, whether you are a Chamber member or not. That at eriepa.com is the best place for our businesses to get the information they need to get the assistance they need. So please reach out to our very capable business partners in Erie County for the help that you need as you struggle through this very difficult time. One other thing that they asked me to say regarding businesses is that please apply for assistance as soon as possible. The money is limited. There's only so many resources to go around, although they are trying to find ways to obtain more resources. And they're working as hard as they can to fully deploy these resources in a reasonable amount of time. But it's important, if you need help, or you think you're going to need help shortly, to apply as soon as possible for that help. Finally, I would like to provide some information for those interested in helping our volunteer-dependent organizations in Erie County. United Way has partnered with us and Serve Erie, and now I would like to ask Marcus Atkinson, the Executive Director of Serve Erie, to come forward to share a little bit of information about how all of you could be part of the solution to helping fight COVID-19 and serve all of our neighbors. As I said yesterday when I was on this press conference, we are trying to make sure we are using very good social distancing habits and hygiene habits here. That's why we're all standing at least 10 feet apart, and we stay 10 feet apart when we're in the studio. I'm also cleaning this podium so that Marcus can come up here and use it safely now that I've finished my talk. Thank you.
Good afternoon. My name is Marcus Atkinson. I'm the Executive Director of Serve Erie. Since the COVID-19 pandemic broke out, there's been a dangerous shortage of volunteers for life-sustaining volunteers throughout the county. In an attempt to build a streamlined and more efficient process in order to meet this need, Serve Erie has teamed up with United Way, and Erie County government to create a process that makes it easier for those that are in need and for those that want to volunteer and give of themselves to these efforts. If you are a healthy individual or an organization in need, we encourage you to go to pa211nw.org. Again, that is pa211nw.org. When you go to the site, there will be a brief questionnaire. At that time, Serve Erie will take the information and match the appropriate volunteers to the appropriate agencies and make the process as simple as possible. In addition, the Erie County Department of Health will work to provide guidance regarding appropriate safety protocols. Again, that is pa211nw.org. Mind you, the county executive's stay-at-home order does not apply to any of you that are volunteering for any of these life-sustaining organizations. Does not apply. So again, if you are a healthy individual, if you are an organization in need, we encourage you to go to pa211nw.org, give of your information, and we'll do our very best to provide needs for you and to help you plug in as an individual. On behalf of Serve Erie and the United Way, we say stay safe, and remember, we are all in this together. Thank you. And following suit with the county executive, I will wipe down the podium if I can reach one of the wipes.
Thank you, Marcus, and I appreciate all the work that United Way and Serve Erie are doing to try to continue to help those most in need in our community. And now I'd like to open it up for questions from our media, and today I'd like to start with the Erie Times News.
Hi, Kathy. It's David. I want to talk a little about the case that was taken to St. Vincent today. The chief of Perry Highway Hose Company expressed his frustration that his EMS crew didn't know the details of the situation when they arrived. They were told to use take extra precautions with the gear, but weren't told that the patient was a COVID-19 person. Was there a breakdown in communication? Can you enlighten us a little bit on that?
My understanding from talking to my personnel at Public Safety was that they were told that they were to use all respiratory precautions and that there was a phone call made directly between the 911 call center and the crew that was on that emergency vehicle taking that patient in.
But the chief did say that was the case. There was a phone call, but he also said it did nothing to indicate that the person had COVID-19. They weren't informed of that until the patient, him or herself, told them. He was very aggravated by that, and he also said, he would like to know if there are other people in there. I understand this is an unusual case, being a traveler, but is that something that the chiefs of these volunteer fire departments need to know, in your opinion?
As far as I know, this was the first patient transferred to one of our hospitals who is an active case of positive COVID-19. And I don't believe there's been any other ambulance transfers besides this particular one. Again, we've tried to do everything we can to keep everyone safe and to also follow HIPAA and all of those things that are in place to protect people. But I was informed that this was discussed during a phone call between the 911 center and the ambulance crew, but I will follow up on that because that's the information that I was given. How about Talk Erie? Do you have any questions today?
Yes, thank you, Mrs. Dahlkemper. Kathy, I'm wondering about if this concept of travelers through Erie County might be our greatest vulnerability, as long as we're using our stay-at-home, doing our stay-at-home duties and our social distancing. We really, can't, stop anybody from coming into town like this new case is demonstrating.
So I've said all along that I think our biggest concern is when people come to our community from another community who has maybe more active COVID-19. They have community spread, for example. And we know that many of our cases of those 8 that we've talked about, either they were the person who came here and because they traveled somewhere else and they're positive, or maybe had contact with one of the other cases. So all of our current cases, as I said, the 8 with 1 still being looked at, are either travel related or direct contact with a positive case. So here we have a traveler who was out working, he did the right thing, you know, and that's what I want everyone to understand. So when people come into our community, and many people are coming back here for various reasons, I got a email from an individual who was out helping in this COVID pandemic and came back to Erie County and is quarantining himself in his home for 14 days. And that is what people should be doing. And I think this really goes to the other piece of this, is that each one of us, when we are out and about, need to understand that anybody who is contagious with COVID-19 and may not know it yet, could have been wherever you're at. They could have been touching that gas pump. They could have been in a convenience store picking up an item and having their hands on that counter. They could be at the restaurant where you're picking up a takeout order, and again have put their hand on a doorknob or on a counter. So the most you can stay away from going inside a building is the best. Stay out of buildings if you can. You know, when you go into a grocery store, if you can, again, have someone else, if one person is going to pick up groceries for your household, that is the best thing. The fewer people in the store, as you said. But think that somebody else in front of you may have touched whatever you're touching, and they may be positive for COVID and not even know it. And you know, I kind of go back to what we said yesterday and what the governor said a couple days ago. If you assume that everyone else is carrying COVID-19, how would you act around them if you knew that for sure? That's how we should be behaving. Jet TV.
Yeah, hi, Kathy, Samir. So just trying to fully understand the picture. So this St. Vincent case, was this person like staying at an area hotel or anything?
That's where they isolated themselves. They were traveling through. I don't think they really thought they were going to stay here, but when they called back to their employer and said, I'm positive, the employer said, isolate yourself in a hotel, and they did. And we were informed yesterday because this person had needs that weren't being met, and so we were contacted by the hotel that there was someone there and they were trying to assist, but we then went and brought this person some needed supplies and things that they needed. So we were very grateful to know that this person did the right thing, that they isolated themselves. They could have left Erie County and kept on traveling, but then they would have infected more people along the road wherever they were traveling to. So, but they obviously traveled someplace before they got to Erie County and didn't know they were sick with COVID-19. And this goes back to the thing we don't know. I mean, people are moving about. That's the way our country has always been. And some people can't stop moving about. You know, for example, we have all sorts of trucks on the road moving product that we need. We need toilet paper because people are hoarding it. We need groceries. We need all of those essentials. We need medicine. And so there is travel on our interstates. And so all of us need to be very, very cautious when we're out and about in a convenience store, a gas station, a grocery store where someone else might have been, whether they traveled through Erie County and never stopped, or whether they are someone who lives here.
So then following up, was the hotel informed prior to his check-in?
I'm not aware of the answer to that. I don't know the details.
So then is the staff going to be tested if they came into contact with him?
My understanding, and I don't really have the details on that, so I really shouldn't speak to it, but you're only tested for COVID-19 if you have symptoms. For the most part, if you've been exposed to somebody, we've been saying this, is that you know that you've been exposed to a positive case, then you should quarantine yourself for 14 days to see if any symptoms appear. If the symptoms appear, then you would contact your healthcare provider and they would tell you whether you should go get tested or not. But just because you've had if you are aware that someone has COVID-19 and you have somehow had contact with them, doesn't mean you're automatically tested. You're only tested, for the most part, if you have the actual symptoms. Because you have to realize, too, someone could be tested today for COVID-19 and be negative, and 2 days from now, or 3 days from now, or 5 days from now, could have symptoms and then be tested positive. So a negative test doesn't mean that you haven't had exposure and won't contract it if you've been in close contact with somebody who has COVID-19. Again, I have no knowledge of what kind of contact this individual had with the hotel, but my understanding is that they were aware that he was in their hotel and that he was positive. So I'm assuming if he was isolating himself, quarantining himself, isolating himself from other people, that no one from that hotel was going in his room. That's my assumption, but you'd really have to, the hotel would have to tell you in terms of what actually happened there. How about Erie News Now?
Hi, a question for you. To the best of your ability, could you take me through a timeline of this person who was taken to AHN St. Vincent in terms of when he arrived here, when he was tested, whether or not he was tested before he came here or after, and then take me through the process of how long he was here before he needed hospitalization?
I don't know how many days this individual was here. My understanding is they were tested in Erie County. We became aware that this person was here in the hotel yesterday. That's when we, meaning the Erie County Department of Health, started providing support for that person. And my understanding is we delivered some much needed medical help. It was medicine, basically, symptomatic, to help with his symptoms, and maybe some water and some basics like that to the individual. And so we provided that, which we take and we drop off at the door, let that person know that the items are there, and then they can come get it. So there's no contact between our personnel and this individual, but we obviously wanted to support him, this individual, any way we could, so we did that. And I don't know the other details prior to yesterday, and then I just know today, obviously the symptoms must have gotten worse, and this person was instructed that if your symptoms get worse, to call 911, which they did.
Gotcha. So if I'm understanding this correctly, then he arrived here, wasn't feeling well. His boss said, stay put, get tested. And so he did get tested here, found out he was positive and was trying to ride it out, and then just ended up needing hospitalization.
That's basically what I understand the scenario was. Again, thank you to him, to the individual. Of course, I've said he, but to the individual and to the business that this individual works for, because they did the right thing. And that's what we're asking people, just do the right thing. Obviously take care of yourself, but protect the community that you're in. And this individual was in Erie County, and this person did as much as they could do to protect our community from further spread, but not only our community, but any community further down the road that this person might have traveled through if they were, if they said, well, I'm not going to do this, I'm just going to head home because I want to be home. And that would be a selfish thing to do, but this person wasn't selfish. This person was very unselfish and stayed in a community that they don't live in, that they don't have any support systems in, because, again, it was the right thing to do. So I'm very grateful that they did the right thing. Erie Times News? Let me ask first, is there any other media outlets on with us today? Hearing none, I'm going to go back to the Erie Times News.
Kathy, can you talk a little bit about the other cases, the 3 cases that do count for Erie County tally, the 2 that are in their 60s? Are those 2 related? Are they a couple? Is there anything you can tell us about their travels and their situation?
I don't really have any more information than I already gave you, David, that we have 2 people now in their 60s, 1 in their 40s, travel related, and we have a third individual that we are still, this one came in late and actually isn't even on the state's website yet, because it shows us as having 7 on the state website. So this is a case that came in late, and we are still gathering obviously all the important information we need to on that individual.
The one that's late is the one in their 40s?
I'm not even sure which one it is, honestly.
Okay, not sure which one. And is the person that was brought in by Perry Highway, are they the only one that's been hospitalized?
They are the only case.
out of all the cases.
The only case. Everyone else that we have, and again, remember the person that was transported is not on our list because, as I said, this person resides in another state. So when you are tested and you put your home address on your information, you get counted where you live, not where you're at. And I think that's important for people to know. This is standard procedure. It's nothing that Erie County decided to do. This is standard procedure across the nation. But this person was tested here, and their numbers went to wherever they reside. So they're not part of the 8 that I've talked about. And of our 8, those people are all convalescing, I believe, in their homes, wherever they reside here in Erie County. And they are in isolation there and recovering, hopefully well, from COVID-19, and none of them have been hospitalized. Talk Erie?
Yes, hi, Kathy. Earlier today, the UPMC Health System had their press conference. They talked about community surveillance testing. They've been doing about 2,000 tests in the Pittsburgh area since January, came up with 9 positives, all in the month of March. How close are we to that community surveillance testing, like the president has been talking about, like the White House task force has been talking about? You just mentioned that you're only getting tested if you have symptoms. When are we going to get out of that mode and start really understanding, how hot the virus is in Erie County?
Well, Joel, that's a great question. We should have been doing this weeks ago, if not months ago. And unfortunately, this country wasn't prepared. We didn't have enough tests, kits, and we weren't set up to do this. In terms of when this might happen in Erie County, that is a question for our health systems who are doing the testing. We have our 2 big health systems, Allegheny Health Network, UPMC, and we also have, obviously, physicians in our community who also have the ability to send an individual to testing in one of our private labs. So that's being done from our medical professional side, and the county health department does not run testing. So that question really would have to be answered from them. I don't have an answer for you.
But just to follow up, there is, as far as you know, this limitation, this bar that people have to cross in order to get a test. They must be presenting with actual symptoms. Is that accurate?
For the most part, they need to have active symptoms. I think there may be some leeway there, particularly if they are a healthcare provider, because we obviously don't want anyone who's a healthcare provider going in and working if they have had contact, and potentially they may be somebody who absolutely is necessary. So I think there may be some leeway there, but for the most part, you need to be symptomatic, and then it's up to your healthcare provider to determine if it really meets the benchmark that needs to meet to go in for a test. I am getting a question that has come in saying that many nurses are mentioning the lack of personal protection equipment and in our area hospitals, and who can they contact for help, and who will protect nurses on their job. And obviously this is a huge concern, not only in Erie County, but across this nation. I can tell you my emergency management and logistics team has been working diligently every day to try to secure more personal protection equipment for Erie County as a whole. And each medical facility should have those protective equipment items within the hospitals. I know that we are in constant contact with those healthcare providers. I know, I'll give you an example, since we did have someone transported today. We have, for example, the masks that everyone's talking about. We have them at the hospital, and every ambulance has them in the ambulance, and when they come in with a patient, we exchange. They throw away the one they have on, and they get a new one and those have been provided through our county's EMA support and agency. So we want to make sure that we are continuing looking for more supplies, because as this grows, which we believe it will, not only across our country and across the state, we believe it will also grow in terms of the number of cases we're dealing with here in Erie County, and we obviously want to protect those who are protecting us every day. And that's why each one of us needs to do our part and help to stop the community spread. And then we can, that's one of the best things each one of us as an individual can do. But if there's someone who's concerned about not having enough personal protection equipment where they work, I would recommend that you call our number at 451-6700, and we can have a call about, we can have a discussion about where you're at and see if we can help through emergency management agency here, through our public safety. Another question about more cases that are in the hospital that aren't being reported. I can only say these are the cases that we have heard of. We have not, and I believe there's more rumor out there than truth to this question, but that is the information that we have at this time. Jet TV?
Yeah, hi. So I wanted to switch to quarantining really fast. So I guess how many people, ballpark if you have one, are being quarantined like by the health department's, I guess, order?
You know, I don't have that number, and it's a number that's probably very difficult to achieve, because each case, depending on what that person did prior to becoming positive with COVID-19, may have a few people they had contact in, or may have many people they had direct contact with. And so every person who had a direct contact with that active case has been contacted or is currently being contacted as I speak by the health department staff, and they are instructing that person to stay quarantined for those 14 days. But that number, I can't tell you what that number is.
Right, and then switching gears a little bit, what about with the stay-at-home order? I know you said we were going to start looking to the other counties to see how they were enforcing that order. Is there any progress made on that?
Well, I think we're doing actually a really good job of enforcement here in Erie County. I think actually we're ahead of the game in the state and the Commonwealth. Many other counties have called us. As you see, the governor put many more counties under a stay-at-home order today. Many of them were calling myself or other members of my team and saying, how did you get a stay-at-home order? Because we want one too. And because everybody knows that this is the most important tool we have, is to tell people that they have to stay home, they have to stay socially distant from each other. And so we're doing great. We have an enforcement team that's out there. We have help from all county law enforcement, whether it be the sheriff or the detectives or probation office, and we've got help from our other local law enforcement entities. And of course, the state police are doing this across the Commonwealth, but we're really lucky here in Erie County that we have a lot of local law enforcement who are working on this. So we're doing a good job. You can't control everyone's behavior, but I think our community overall is doing well, and doing well trying to remind each other about the fact that everyone needs to socially distance from each other. Erie News Now?
Hi, a question about the person at AHN St. Vincent. Do you have any word on that person's condition? And also, do you happen to know how many negative tests we've had so far in the county?
I do not have a number on the negative tests, and I do not know the condition of the person who's currently hospitalized at this point.
Thanks.
Erie Times News?
Kathy, let's get your thoughts on the rest area. PennDOT, you did reach out to them. I had talked with them earlier today. They did open the one, the Ohio side one. They did not open up the one in Northeast. How vital is it for them to open up that one in Northeast, especially from your viewpoint, the concerns about travelers and then coming in and using convenience store restrooms and, coming into more contact with Erie County residents? How important is it that that other rest area opens up quickly?
Well, I was glad for the question yesterday because I was not aware that these two rest areas were closed, and so it was one of the first things I did at the end of my press conference was call and connect with PennDOT about this. From the day one when they closed all the rest stops and all the restrooms across their footprint, I thought that was a bad move in terms of controlling this for a number of reasons, because as you just mentioned, if they cannot stop at a restroom that's on the highway, they have to stop somewhere, and now there'll be more into our community where other people in our community tend to go. I mean, most of us don't stop at those two restrooms. I don't know that I have ever been to either one of them myself personally. So I don't think most of us ever stop at the rest stops within our own county. So getting those people that are traveling through into the rest stops that are provided for them helps to keep them from entering our county and potentially spreading COVID-19 to our residents. And so I have expressed this, and I was glad they were disinfecting and opening up the eastbound lanes facility that's close to the Ohio line, and they said as soon as they can, and they hoped within days they would have the westbound facility open, the Welcome Center in Northeast. So I appreciate PennDOT's diligence and to getting this resolved. And I know it's not easy, and they were trying to make the right decision. And I'm not just saying the initial reaction wasn't the right decision in terms of trying to stop the spread, but I think maybe it hadn't been thought through fully, and now they are thinking it through fully. And I appreciate the change in direction that PennDOT has taken on that. Talk Erie, do you have another question?
Just one more, Kathy. I'm a grandparent. You're a grandparent. I'm hearing these stories coming from listeners who grandparents have been designated caregivers because the child care facilities have closed, but the son or daughter of the children is in a life-sustaining business, and they're having to come and go, possibly bring germs coming and going. The grandparents don't have any access. There is absolutely no hand sanitizer in the community. They're running low on other supplies. Can you give some hope and some advice to grandparents that have been caught now in this child care situation that and they're really without a lot of options?
And that is so true, that grandparents are often at a place where they are filling in for those daycare centers. And obviously, thank you to all of them that are willing to do that so that those in life-sustaining businesses can get to work and do what they need to do. Hopefully everyone has soap. And washing your hands with soap and water will do just as well as using hand sanitizer. Taking soap and water in a bucket and a washcloth and a rag and cleaning off those doorknobs or any place that people are touching, as many surfaces as you can. Of course, with kids, we know they touch everything. So it's very difficult, but I would have a very frank conversation with the children's parents and figure out a way to minimize the transfer of any potential COVID-19 viruses. When the days are nice, be outside with the kids if you can be in the yard, obviously socially distant from other children, but being outside is actually a good thing. It's very hard. It's much harder to transfer the virus in an outside situation, especially when you're 6 feet away from anyone else. But go on the website, look at the common ways that you can get rid of the virus, wash clothes often, all of those type of things that we've been talking about. Just do more of that, and hopefully the spread of the virus will not happen to these grandparents. That would be very, very tragic, and obviously nothing any of us want. But obviously they're doing a great service, and something I think they probably know they want to do for their families. Jet TV, do you have any last questions?
Yep. So I have a question regarding businesses that are staying open that do not have waivers. So I believe the fine is around $300. So for some companies, that might not really be that much. So I guess what would be the next steps if they still defy the order?
Well, obviously, eventually it could go into a court situation. We hope never to have to get there. We haven't had any businesses who've gotten to that point with us. I think once we go and we speak to them, most of them become compliant right away. We've had a couple incidents where we've had to post on the business that they are closed. There's always the opportunity, which would be drastic, and we don't want to do that, to take away their license. If they're a food establishment, if they're the LCB could take away a liquor license. Those type of things could happen. So there are other avenues that we would go down with the district attorney if need be, but luckily we haven't had to do that in Erie County. and our businesses are being partners. They're being partners with us in trying to stop the spread of COVID-19. So we need businesses, we need our residents, we need all of our nonprofits, our churches. We need everyone to work with us on trying to stop this spread and work collectively together to help us stay ahead of the curve, because we are still ahead of the curve here compared to most other communities surrounding us in our Commonwealth and even many across our nation. And that's why we're taking these actions and being so strong about them now to stop this virus from becoming rampant through our community.
And then, do you know where the St. Vincent case, where he is from?
I just know that this person's from out of state.
Okay, thanks.
Erie News Now?
Hi, final one for you here. That person who is hospitalized at St. Vincent, any clue of the business he was on was what we would consider essential business? And just how frustrating is it, too, to have to work backwards on these cases where you find out somebody is positive and then you can get to work trying to backtrack this thing as opposed to having that widespread testing?
The widespread testing obviously would be much better, but even that, it gets to a certain point where the best thing you can still do is social distancing, even with the widespread testing. So I wish we'd had the widespread testing weeks, as I said, if not months ago, but that's not what happened here. And the first part of your question was, repeat that for me again, I'm sorry.
Person who's hospitalized, any clue of the business he was on would be
yes.
something that we would consider essential business here in our state?
My understanding is he was on business that is life-sustaining, and so had certainly the right and the ability to be out there. And again, I can't say enough about this person and his business really doing the right thing once they knew the situation, to protect not only that person, but protect everyone that person might come in contact with. So we should commend that person and his business that he works for doing the right thing.
Thanks.
Well, with that, I want to end our press conference today. Again, thank you to our partners. I want to again thank Marcus Atkinson and all the work that Serve Erie and Unite Away are doing to try to match our nonprofits that still need our help with volunteers who are healthy and maybe can assist during this very, very difficult time. I want to remind businesses who are looking for resources to go to our Erie Regional Chamber and Growth Partnership, eriepa.com, to find the resources that you might need in this very difficult time for your business. And I want to remind our residents to please keep your social distance from each other, to wash your hands frequently, to use hand sanitizer, to sanitize places where people may touch that you might be touching, and do the right thing and stay socially distant from each other. And together we're going to get through this. Please stay safe, stay home, and stay calm.